This video is about how services in Leeds can support someone who has found out they are pregnant and would like to know what their options are. In England, if someone has found out that they are pregnant, they can choose what they would like to do. This includes those that are under the age of 16, have a learning disability, have migrated to England, or they are visiting England. They can continue with the pregnancy, or they can access services to end the pregnancy. This can be called an abortion, or can sometimes be called termination of pregnancy. Having an abortion in England is free on the NHS. Whether they know they want to end the pregnancy or if they are not sure, either way, abortion services in Leeds can offer advice and can support people to understand and work through all the options so that the person can make the choice that is right for them. The person's partner or father of the child has no legal rights to make any decisions about their pregnancy and does not need to know about the abortion. This means that the pregnant person does not need the agreement of their partner to get an abortion. If they do choose to end the pregnancy, abortion services will then explain the types of abortion and work with the person to decide which is appropriate for them. They will talk them through what will happen, what to expect, and give them time to work through any questions or concerns. When the person is sure they want to have an abortion, they will be asked to sign a consent form and a date for the abortion will be arranged. The pregnant person can change their mind at any point up to the start of the abortion. There are two main abortion options. There is the medical abortion, sometimes called the abortion pill. For this, the person will take two medicines, usually 1 to 2 days apart, to end the pregnancy. There is also a surgical abortion. This is where the person will have an operation to remove the pregnancy. They can normally go home soon afterwards. Whichever option the person has, they will probably need to take things easy for a few days. It is likely they will have some discomfort and vaginal bleeding for up to 2 weeks. If the person gives permission, abortion services like to send a letter to their GP, but their GP does not need to know. The GP does not need to be told about any visits or conversations the person has had with abortion services. The GP does not have to know the person has had an abortion. A person also does not need to be registered with a GP to have an abortion. All these services are completely confidential. This includes if the person is under 16 or if they have a learning disability. They can choose not to involve their parents, carers, or other supportive adults, although they are encouraged to do this. Services will only need to break confidentiality if they feel the person is in any danger or feel that they do not have the ability to use and understand information to make a decision. However, the services will try to speak to the pregnant person first and only speak to who they need to ensure they are safe. They can also support the pregnant person with ensuring this stays confidential in other areas of their life. For example, they can provide an anonymous letter for their employer so that their work does not need to know about the abortion if they need time off. The abortion services also provide aftercare. This means if they need services after the abortion, for example counselling or needing antibiotics, instead of going to their GP, they can get them at these services. The 3 trusted abortion services that are in Leeds are the British Pregnancy Advisory Service. Their website is www.bpas.org. The National Unplanned Pregnancy Advisory Service, their website is www.nupas.co.uk, and MSI Reproductive Services. Their website is www.msichoices.org.uk. Facing an unexpected pregnancy or one that someone is unsure about can be a worrying and isolating process. The person may feel that they would like a little more support. The Pregnancy Choices Advocacy Service offers impartial information on midwifery and abortion options and one-to-one support, including practical support for appointments. This service is for anyone who is pregnant and whether the decision is to continue or not continue with a pregnancy. You can get more information or discuss a potential referral at www.women'shealthmatters.org.uk/PCAS. Remember, pregnant people have a choice of continuing or ending the pregnancy. This includes if they are under 16 years of age, have a learning disability, have migrated to England, or they are visiting England. A pregnant person can talk to abortion services to discuss their options, and they can offer them aftercare services. Pregnancy Choice Advocacy Service is there to offer further support. The person does not need to be registered with the GP to have an abortion. Abortion services are confidential for everyone, and having an abortion is free on the NHS. If you would like to find out more information on abortion, you can visit the NHS website on www.nhs.uk/conditions/abortion.